proposal to be heard today, together with the public notice of the hearing. The proposal was duly noticed prior to today's hearing. Copies of the notice were sent by email and the United States Postal Service to all interested parties whom so requested. In addition, the notice, regulation text, initial statement of reasons, and other supporting documents are available on the department's internet website.
In order to provide an equal opportunity for individuals to speak, we ask that you limit your comments to 3 minutes per speaker. We will call time as appropriate. As you have already been made aware, you may submit, and we will accept written materials for the record as previously instructed and as has been ongoing during the 45-day public comment period for these regulations. All oral testimony, as I mentioned, will be recorded via Microsoft Teams, and therefore will be considered along with the written testimony that is received during the public comment period. All comments are considered equally on their merits, regardless of how they are submitted. And as a reminder, please put your phone on mute. As a reminder, this is not a time for questions and answers. We will simply be listening and look forward to your oral comments. So I have a list of phone numbers of people who are on this call. I will call out the last 4 digits of your phone number, so pay attention for those 4 digits. And we will take you can take yourself off mute. And if you have comments, as mentioned, you have 3 minutes. If you have no comments, that's fine. If you're here to listen, that's fine. You can just say no comments. And let us begin. On my list, the first phone number ends with 2138. That's phone number ending in 2138. If you have comments, please come off mute. Okay, hearing none, I will move on to the next phone number on my list. And when I get to the end of the list, if somehow we have missed you, please feel free to speak up. I have 30 participants so far on this call. So again, the next phone number on our list is last 4 digits, 5248. Please come off mute if you have comments. Phone number ending in 5248. This is your opportunity to make comments. Hearing none, we will move on to the next phone number. Last 4 digits, 3113. If you have comments, please come off mute. 3113. I see you're off mute. Go ahead, please.
Oh, hi. Good morning, Dr. Chapman.
Hello, Basil. How are you?
Okay, very good. Yeah, so my name is P. Basil Vasundachan. I'm the Health Director and Health Officer for the City of West Covina. On behalf of the City of West Covina and our West Covina Health Team, we want to thank you, CDPH and Dr. Ron Chapman and the team, for meeting and working with us during the last 4 years. Thank you for your patience, encouragement, and guidance in building our health department brick by brick, puzzle by puzzle, to eventually, hopefully, putting the whole picture together as this public health regulation package going through the final phase of approval. You have done so much for us in researching and analyzing all the detail on how to have a successful new local public health department. We are so fortunate to have your support by putting the CDPH expertise and wide-based knowledge and experience together to help us. This public health regulation package is so well thought of and to detail on how to have a successful new local health department under CDPH guidance. During the last 5 years in my research for blueprint on how to establish a new local health department, this package, I believe, will be first in the nation. A couple other states and cities have snapped the finger and built a new local health department without blueprint and process, and it's just a difficult test. So this package will make it very simple for us to follow. As part of the frontline work, we're working with patients daily in the outpatient and inpatient setting in multiple institutions, especially during the COVID-19 pandemic. We have constantly struggled and fighting to get information, resources, and treatment for our patients to prevent them from getting infected, and when they get infected, trying to save their lives, working on continued developing and implementing innovative and evolving treatment to save their lives, working with a team of medical consultants. Basically, you have patients crying for help that they can't breathe, or they are incapacitated on the life support machine. And as a patient surviving a 2-week stay in the COVID ICU after exposed to contaminated PPE provided in emergency by unintentional staff, I know firsthand how difficult it is in getting help and resources for our patients to save their lives. And the difficulty in getting authorities to recognize the failure and to immediately remediate the problem to prevent the next open heart patient, the next
30 seconds left.
Patient, the staff and the visitors from exposing and coming down with COVID. As for community, my past 40+ years as a practicing healthcare provider and consultant involvement in connection with the community, including hospitals, schools, churches, associations, can be extremely helpful. I personally was asked by the city and all these association organizations to help out in securing vaccine and medication to combat the pandemic to prevent the spread of COVID and to save lives. Daily, you have to talk and discuss with each patient in detail the current information and treatment available to save their lives, their family, and their friends. I believe to prevent future pandemic, epidemic, and
3 minutes. Time up. Thank you.
Oh, okay, sorry.
Thank you, Dr. Bazantachart. As a reminder, we are going through a list of phone numbers of participants on this call. For all of you, please put yourselves on mute. When I call the last 4 digits of your phone number, you can come off mute and make comments, or not if you prefer not to make comments. And as a reminder, you have 3 minutes. We will give you a 30-second warning and let you know when the 3 minutes are up. Next, 4 digits phone number ending in 1295. I want to make sure I give people enough time to figure out how to get off mute. Your phone number ends in 1295. If you have comments, please come off mute. If not, we will move on to the next phone number. Next phone number ending in 5135.
Yes, I'm here.
It's not coming out.
Hello, can you hear me?
It's not. You have to unmute. Star 6.
Thank you. Next phone number ending in 8749.
Hello, I'm
You're
here.
no longer muted.
Came off mute.
I'm sorry.
Go ahead,
Yes,
please.
I'm sorry. I didn't understand how to come off mute, but I am ready to speak. Go ahead and start now.
Go ahead. Do you have a comment?
Yes, I do.
Yes, please identify yourself and your organization, and you have 3 minutes. Thank you.
Okay. My name is Mario Luis Saldivar, resident of West Covina. Good morning to the members of the Office of Regulations and fellow stakeholders. Appreciate the opportunity to speak on DPH-21-009, new local health department application regulations. First, lack of demonstrated community support. Title 17 currently requires only a perfunctory community support statement, but the City of West Covina's public workshops in May and June 2025 revealed overwhelming opposition to forming a city-run health department. Dozens of residents, both lay people and local business owners, voiced concerns that this proposal duplicates existing Los Angeles County services and diverts scarce city resources. Under the proposed regulations, a city could proceed with little more than a brief survey. I urge you to strengthen the requirement by mandating documented majority support, such as City Council resolution ratified by public referendum or a validated petition reflecting at least 50% plus one of affected households before any application is accepted. 2, insufficient financial accountability. The notice lays out the steps for application, but it does not require submission of a detailed certified budget for startup and ongoing operations. West Covina's fiscal year 25-26 budget allocates $0 for this purpose, yet the city plans to rely on unspecified state aid to fill gaps. Without a line item budget demonstrating secured funding sources and realistic cost projections for staffing, facilities, and public health programs, there is no way to ensure that local taxpayers will not be on the hook for unanticipated deficits. I respectfully request that the final regulations require each applicant to include a certified financial plan, complete with projected revenues, state and federal aid estimates, and contingency provisions, so that DPH can verify that the planned health department are sustainable from day one. Lastly, need for formal public hearing and local resolution. Currently, applicants need only provide a brief summary of their public hearing process. I recommend that the regulations specify that the applicant city must hold at least one formal public hearing, noticed at least 30 days in advance, solely dedicated to the health department proposal, and that the city must submit a certified copy of the hearing minutes along with a formal council resolution adopting the application. This ensures true transparency and gives DPH clear evidence that local officials have generally weighed community input before moving forward. In conclusion, by tightening the community support threshold, mandating certified financial plans, and requiring formal local resolution, you will preserve the integrity of the application process and protect both state funds and city taxpayers from underfunded or unpopular ventures.
30 seconds.
Thank you for your comment. Please place yourself on mute and we will move on to the next phone number. The next phone number is ending in 8749.
You've been muted. To unmute yourself, press *6.
If you have comments, please come off mute. We are going through a list of participant phone numbers. We are now at the last 4 digits of phone number 8749. And I see you're off mute. Please identify yourself. Yes, thank you.
My name is Teresa Kozad. I am a resident of West Covina. First of all, I would like to say that I think you need to review how to come off of mute, because that may be why a lot of people are not answering. I would like to mention that, first of all, I think you should include a financial stability, something in the references, because our city is not financially stable and there is no funding for the health department. As the previous speaker stated, they have initiated no funding. Also, we were told in workshops that it wouldn't be ran by the city, it would be ran by Trans Tech, which is outsourced. Also, there were some community meetings held, but it didn't seem like the city took there were no intentions to listen to the residents of the city, because no one that I know of that was at the city meetings supported having a health department. Everyone spoken not in favor of the health department. Also, we are going to be paying double for services that are already provided by the county. And no one wants to be doing that, especially in this day and age. And finally, Dr. Basil always refers to the city. The only people that decided to do this was the city council, headed by Mr. Wu. No one else is in favor of this health department. Thank you very much.
Thank you for your comments. And please place yourself on mute. For those of you who joined, we're going through a list of phone numbers of participants, calling out the last 4 digits. And you need to come off mute if you have a comment. I appreciate the last speaker mentioning how to get off mute. Michael, Hannah, I believe it's *6 on your phone. But other folks have input on how to get, yeah.
Or it will be the little button with the microphone crossed out if you have a handheld phone.
Yeah. Thank you. All right, I believe the next phone number on my list ends in 4301. If you have a comment, please come off mute. phone number ending in 4301. Again, if I get through the list and I skip someone or you didn't have a chance to come off mute, we'll make sure you have the opportunity. I see 4301 not coming off mute, so I'll move on to the next phone number, 9321, phone number ending in 9321. If you have comments, please come off mute.
And you do press *6 if you do come off mute, just to confirm.
Got it. 9321, I see you're off mute. Please state your name and organization if you have one, and you have 3 minutes. Thank you. Go ahead, phone number ending in 9321. You're off mute. We do not hear you. All right, we will move on to the next phone number on our list, ending in 0298. Phone number ending in 0298. I see you're off mute. Go ahead.
Hello?
Yep, I can hear you. Go ahead.
Oh, okay, good. Hi, my name is Peggy Martinez. I am a West Covina resident, and I am not in favor of our own health department. Our city simply cannot afford it, and I think the state needs to really take a deep, long look at the finances of our city. They have already spent over $1 million on this project, and the money that we really don't have that we could use on other things. We already have LA County that we pay through our property taxes, and we aren't going to get that money back. I personally don't think we need a health department. They're farming stuff out already to Long Beach and other entities. TransTech has never developed a health department before, so I have no confidence in us getting anything that would be decent. They've already admitted in a council meeting that certain things that schools get that the LA County Health Department provides, like hearing tests and stuff like that, would have to be farmed out to the state. So I honestly don't think a city of 100,000 people needs its own health department. It's really not needed, and I am totally against it, and I want the state to decline that application. Thank you.
Thank you. Moving on to the next phone number ending in 7709. Please come off mute if you have comments. Phone number ending in 7709. If you are interested in making comments, please come off mute. Hearing none, we will move on to the next phone number, 4554. Phone number ending in 4554. Please come off mute if you have comments.
And just a reminder, you press *6 on your phone to come off your mute or go back on mute.
Going to move on to the next phone number, and if you're having trouble getting off mute and finally figure it out, we will come back to you. Next phone number on my list, ending in 8396. Phone number ending in 8396. If you have comments, please come off mute. by pressing star 6. Thank you. I see you're off mute.
Hi, my name is Kelly Blaken. I am a resident of West Covina, and I am against the own health department because West Covina is already at risk of bankruptcy, and I don't think more levels of bureaucracy and government can help. And it's just that I think it's a waste of taxpayer money. There's no reason for it. I think it should just stay in LA County, and that's about it. Thanks.
Thank you for your comments.
No problem.
If you're not a speaker, please place yourself on mute. Moving on to the next phone number, 7400. Phone number ending in 7400. If you have comments, please come off mute. Phone number ending in 7400. Okay, hearing none, I will move on to the next phone number on my list, ending in 1168. If you have comments, please come off mute by hitting star 6. Phone number ending in 1168. And I see 7400, you're off mute. Do you have comments?
Yeah, I will tell you, it is a lot harder to unmute ourselves than you think if you can hear me.
I understand. No worries. Appreciate your coming on.
No worries. Do you want me to start or do you want me to wait?
Yes, please go ahead and identify yourself and any organization you're affiliated with, and you have 3 minutes.
Thank you. My name is Steve Bennett. I'm a resident of the city of West Covina and very active in the city in a lot of ways. I oppose the city of West Covina, but moreover, as part of the policies of this department, I hope you guys do a few things in the way of preventing cities like ours from getting a health department. Ours has already been ranked financially high risk by the California State Auditor, and I think that has to be something that this department addresses for any city that wants to move forward with a own health department or their own city's health department. I think that is a very large qualification that a city must be able to sustain itself financially. And if they can't sustain themselves financially without a health department, there's absolutely no way that they're going to sustain themselves with a health department. And there's no way to get enough funding through grants and such to make that happen. Recently, and to give you an idea of how poorly our city is managed, recently in May, the city enacted a new resolution removing the requirement for any department head to have a degree resolution. That means that our city manager and any department head can have simply a high school diploma running our city. I have a real issue with the fact that we have a city that has people who may not have the level of education that is required to run the city, much less on top of that oversee a department of health in our city. There's also a lack of public support. You're hearing it on this call today. There has not been a single person other than the 5 members of the city council. There's a majority there, and there are a couple of supporters, including Dr. Basil, who support this. I recommend that this be something that the department push to require these cities to have a vote of the people. It needs to be out there so that the people actually know what's going on. There are 100,000 residents here, and I would say the majority of people have no idea that this is taking place. Lastly, TransTech is an engineering firm. They have never done anything with a health department. Our city has tapped them to set this up. I would appreciate the department look at the requirements as well to make sure that whoever is actually overseeing this is not just simply a doctor, but if it is contracted out like they are trying to do in our city, that contracting firm actually has the ability to start and manage a medical-based facility or medical-based department. They have zero knowledge and experience in this. There is nobody at TransTech that has that except for Dr. Basil. And lastly, someone mentioned earlier the property taxes. Our property taxes are given to LA County currently. I believe we need to look at something. Thank you. I believe we need to look at something that takes the property taxes and separates those out of our property taxes, which are not currently done in any city or county, and then have that money be reallocated. And until that's done, I don't believe that is appropriate. And again, I vehemently deny the want of a health department in West Covina. Thank you very much, guys. Have a great day.
Thank you for your comments. And I'm going to move on in our phone list to phone number ending in 1168. And again, when you speak, you have 3 minutes and you'll be giving a 30-second warning before your time is up. Phone number 1168, please come off mute if you have comments. Okay, going to move on to the next phone number on my list, 7223. Phone number ending in 7223. You can hit *6 to come off mute if you have comments. Phone number ending in 1168. And I'm sorry, 7223, I believe is where we're at. If you're not speaking, please put yourself on mute. Thank you. I'm not seeing 1168 or 7223 coming off mute. I'm going to move on to the next. 7223, you're off mute. Go ahead, please.
Okay. Can you hear me?
Yes. Thank you.
Okay. My name is Sherry Brillin. I'm a 68-year resident of West Covina. I am definitely opposed to this health department. The cities of Long Beach and Pasadena have operated their own health department for well over 100 years. And yes, they have had to take millions of dollars out of their general funds to cover the costs of layoffs, which they've had to perform. They also experience health department heads with certification that comes with running a health department, both MDs, master's degree, and business certifications, manage such a huge undertaking as this. Our city council thinks it's good enough to hire a PCP, primary care physician, or GP, general practitioner, with no business experience to run a multi-million-dollar state-of-the-art health department with no experience. The city of West Covina does not even have an action plan of how to even operate a health department and no way to finance the whole department. Please take time to look at Dr. Basil, who is just an MD. Our mayor, Tony Wu, has selected him to be the department head. Please look at Dr. Basil's resume, for lack thereof, his qualifications of running this. At present, Wu has hired an outside company, TrazTech, to run this health department, also with no experience running any kind of medical facility. If there is no plan to run a sportsplex for playing a game of baseball, then what is this city going to do with when they lose $1 million playing with our sportsplex? What do you think they're going to do running a health department? They're going to put lives at risk for many, many years. Just a note to verify that the city of West Covina is running, it should not run its own, has been on the West Covina City Council. He has fired 3 city managers, 2 fire chiefs, 1 fire chief and retired, a police chief and the fire chief. They have both won $4.5 million lawsuits. We have no financial director. 3 have quit. We have no HR director, gone through 3, no maintenance department head, and numerous cases of hostile work environment due to Tony Wu's temper and control issues. The numerous lawsuits. We do not have a working environment with the council to afford this. I agree with Steve Bennett that this needs to be put on the ballot. This is a vote, or this is a mandatory, it should be a mandatory for the city of West Covina residents to vote in the 2026 election on this particular issue, giving us the knowledge that we do want it or we don't want it, and not just the majority of 5 on the city council who say they want this for some other prestige. Thank you.
Thank you for your comments. Moving on the list, the next phone number ending in 0689. please to come off mute if you have comments. Phone number ending in 0689. Move on my list to phone number ending in 4272. If you have comments, phone number 4272, please come off mute. Thank you. I see you're off mute. Go ahead.
Hello?
Yes. Hi, I can hear you.
Thank you. My name is Frederick Sykes, and I'm a resident of West Covina. I lived here since 1978. And because the previous speakers have been very succinct and to the point, I can be very brief. And I will apologize for this repeat information. This is necessary because our city council is ignoring the residents. And specific to West Covina, the residents already face a limited situation with services, and creating a city health department will only worsen the financial strains and existing service challenges. If you were to visit the city of West Covina today, you will see that we have management problems. We have open green spaces, parks, and streets that are unkempt, period. Again, thank you for your consideration.
Thank you for your comment. And we're going to continue down the list. Next number on my list is 9215. Phone number ending in 9215. If you have comments, please come off mute. And again, if you were unable to come off mute previously or we skipped you, we will come back and give you an opportunity at the end. Okay, moving on to my list, 5669, phone number ending in 5669. If you have comments, please come off mute. I see you're off mute. Go ahead, please. Oh, you're back on mute. 5669, I saw you come off mute and now you're back on. Oh, there you go. You're back off mute. Go ahead, please. Yeah, I can hear you. Go ahead. Thanks.
Thank you, Angie Gillingham. I wanted, as a resident of West Covina, I want to strongly oppose this proposed establishment of a new health department in our city. This endeavor is not only unnecessary, but also fiscally irresponsible and untimely, not in the best interest, and ultimately not in the best interest of our residents, and as you've heard today. This push seems to be for a health department, seems to be politically motivated, as many have expressed prior to me speaking. This is a very unpopular effort by the city council. I was part of a small group of residents that formed No to WC Health. We were doing this at the time of COVID. We collected anywhere between 25 and 2,700 signatures at the time of COVID when Mr. Wu came up with this ridiculous suggestion. And 2,700 signatures, we were not able to get it on the ballot. But I want you to know, through the time of COVID, those residents came out and signed our petition, and we would certainly be able to hand them over to you, Dr. Chapman. But anyways, this seems to be a waste of $1 million of tax, at least $1 million so far at this point. The funds that could be used instead towards urgent and tangible local priorities are being diverted to resources such as Dr. Basil. And it would take years for us to be ever functional, anything in comparison to the county system. We would never be efficient. We have no faith in this council or its ability to select individuals, as Mr. Bennett had expressed earlier, that we are now working at people from potentially at a high school level in positions we feel as residents should continue to keep standards that have always been in place for the city of West Covina, not substandards that this council chooses to have. So if you're interested in looking at those signatures, we would be more than happy to share with you the group that I was part of on No to WC Health. We would definitely love to share them with you, and thank you for hearing me out.
Thank you for your comments. I see 9215 is off mute. Did you have a comment?
Hello?
Yes, hi, go ahead.
Hi, I'm a West Covina resident. I'm concerned about West Covina. My name is Cami Polis. I'm concerned about West Covina having its own health department. I don't want to put West Covina residents at risk. I've been a resident for 67 years, and West Covina in the last 5 years at least, probably many more, have not been fiscally sound. And if California auditor puts us at risk financially, please do not allow West Covina to put its residents' health at risk as well. I appreciate you giving me the time to make this comment.
Thank you. Appreciate the comment. Okay, I'm going to move on in my list of phone numbers now at phone number ending in 9627. 9627. If you have comments, please come off mute. And I see you're off mute. Go ahead, please.
Hi there, Ron. Am I coming through?
Yes, all good.
Perfect. Thank you so much. My name is Oli Cantos, and I'm a resident of West Covina and a member of the West Covina City Council. I wanted to add some perspective with regard to what fellow residents have been expressing earlier in opposition to West Covina's application being accepted. First of all, I'd like to commend you for just working to modernize regulations. And as part of your effort, what is really important for the entire state, and not merely about West Covina, is to incorporate a provision that takes into consideration the fiscal soundness of the entity that is applying for to become its own health, to have its own health department. Specifically, as has been mentioned already, we are designated as high risk by the state auditor. The report from December 2024 was the latest report that documents this. And when the residents here who have talked already have spoken about the issues within our city, I realize that is beyond the scope of what is described here in terms of your own jurisdiction. But what is really important is to recognize that whenever any entity applies to have acceptance by your department to have a health department, that its ability to manage programs will be taken into consideration. Even if there are grants that are available, and even if the grants are available over the next 1 year or 2 years, we need to think about the longer term prospects of what can happen if grant money runs out. And especially in this federal environment where grant money is actually in the process of being clawed back because of things happening there, we cannot rely merely on federal funding alone that trickles down to the state that comes to us. It is also important to recognize that when any entity does not have a solid record of providing the quality services already that it should provide, then that should also give reason for pause. When others have discussed infrastructure issues, that is true. Our PCI, our pavement condition index, is lower than 80 as an example. The Sportsplex has been a debacle with our literally losing at least $400,000 to $500,000 a year when we used to make $400,000. Those are just two examples, not to mention the lawsuits that are happening here. So it is really important from a regulatory standpoint for you to add the provision that only makes eligible cities that are low risk, and maybe low to moderate, but low risk for sure, so that those who are applying to you can already say that they have a record of financial stability to be able to make that happen. Thank you so much.
Thank you for your comment. And I will move on the phone list. Next number I see is 8402, phone number ending in 8402. If you have comments, please come off mute. by pushing *6. Phone number ending in 8402. I will move on to the next phone number, 8475. If you have comments, please come off mute. 8475. And as I've mentioned previously, if we passed your number and you were unable to come off mute or change your mind about making a comment, we will come back to you. We're now on 8402 and 8475. Okay, moving on my list now, phone number ending in 5779. If you have comments, please come off mute. Phone number ending in 5779. Moving on my list, phone number ending in 7687. I see you're off mute. Go ahead, please.
Hi, I don't have a comment, but I have a question. I'm from the County of Santa Clara Public Health Department, and I believe our health officer is on the line, but she joined a little bit later. Is she like added to the end of the list to make comment?
All I have are phone numbers. I don't have names, so I'll be going through the list of names. We've got 38 participants, so I have a long list of phone numbers. I'll be going through every number.
Can you just confirm that you have 3123 somewhere in there?
I'll check for that.
Thank you, Hannah.
Appreciate it.
Do you have any comments?
No. She will have.
Thank you. Thank you. Moving on to the next phone number ending in 6958. Phone number ending in 6958.
For that previous question, I do have, I have 3113, I have 3123.
Thanks, Hannah. We're now at phone number 6958. Phone number ending in 6958. If you have comments, hit *6 and come off mute. Next phone number on my list, 1669. If you have comments, phone number ending in 1669, please come off mute. Moving on my list, phone number 4902. Phone number ending in 4902, please come off mute if you have comments. Okay, moving on my list, 9067. Phone number 9067. Please come off mute by hitting *6 if you have comments. And you're off mute. Go ahead, please.
No comment.
No comments? Thank you. Phone number 7540. If your phone number ends in 7540 and you have comments, please come off mute by hitting *6. Okay. And phone number 7828. Phone number ending in 7828. If you have comments, please come off mute. I'm not seeing folks come off mute. 7828, 7540. I see phone number 3123 is off mute. Do you have comments?
Yes, I do. Hi, Ron. This is Dr. Sarah Redmond from the County of Santa Clara. I'm calling on behalf of the Public Health Department just to register significant concern about the current draft of the regulations, worrying specifically that they don't require a sufficient amount of commitment and coordination from any new proposed health jurisdiction to guarantee that their residents of the new jurisdiction would receive the same or greater level of public health service as they currently receive from their county. I think that current proposal poses a significant risk to the public of losing access to services, either during or after the transition to the new jurisdiction, either from decisions by the new jurisdiction, fragmentation of services across too many smaller jurisdictions and losing economies of scale, or simply insufficient resources as there are multiple jurisdictions in the current environment. So our specific recommendations are as follows. 1, CDPH should limit eligibility for state aid funding to a new jurisdiction to only when a new appropriation is made by the legislature that's sufficient to support new LHJs without reducing funding to the existing ones. 2, add a requirement for the city to disclose financial ability to sustain services transferred from a county for a minimum of 3 years and to cover the cost of a transition period to plan for and launch the services and allow overlapping period while the county is still funding the same services. 3, add requirement for data sharing agreements between the city and county jurisdictions, especially related to reportable diseases. 4, add requirement for a new LHD to receive full approval and state funding. It must be prepared to provide all LHD services within 24 months of being approved. 5, consider a requirement for a minimum time frame for which the new jurisdiction must demonstrate the ability to support public health services so that the services don't bounce back and forth between new and former jurisdictions. 6, add a requirement for meetings between the proposed city jurisdiction and the existing county jurisdiction to agree upon which services will transfer and on what timeline. And finally, a requirement for a public hearing for residents of the new city jurisdiction to receive information from both the new proposed jurisdiction and the current jurisdiction about the proposal and the impacts for residents, and give an opportunity for public comment by impacted residents. Thank you for your response.
Thank you for your comment. Okay, we've noticed a few folks who have come off mute that did not have a chance to speak, and if we've already called on you, I apologize. Just want to make sure we're not missing anyone. I see 9321, you're off mute. Do you have comments, please? Phone number ending in 9321, I see you're off mute. Do you have comments? Okay, thank you. Also, note that, thank you. Phone number ending in 9627, did you have an opportunity to speak?
Yes, Ron, I did. Thank you.
Oh, thank you. Just want to make sure. Phone number ending in 3008. Did you have a chance to speak? 3008. If you have comments, please come off mute. And also, I believe 4006 came off mute at one point. If you have comments, please come off mute. 3008 and 4006. I see 4006, you're off mute. Have you already commented? Did you want to have a chance?
I have not. I'll make it quick. I have not commented yet, but
Thank you.
basically I've been in the city for the last 10 years. I've seen 3 city managers, a couple of police chiefs, and fire captains. It's like a revolving door. It doesn't seem like they can even get the sportsplex baseball field or street sweeping even correct. So I really don't have any confidence that they can get a health department set up correctly. And it just seems like the city is just setting up a lot of new projects but not following through to completion. And after talking with a lot of my neighbors too, they thought this project died years ago, and they're just surprised that the city hasn't really announced anything that they're still pursuing this endeavor. So it's really disappointing that they've kept it kind of hush-hush, saying that people want it, when a majority of my neighbors around where I live have no idea that it's still being pursued. So I think it should go to ballot or be open for more discussion. But a lot of my neighbors were surprised that the project is still ongoing. They thought it died out years ago. That's about it that I have to say. Thank you.
Thank you for your comments. And I believe phone number ending in 2032, you're off mute. Did you get a chance to speak?
Yeah, no, not yet.
Go ahead, please. Identify yourself, and you have 3 minutes.
Yes, this is John Shoemaker. I'm just reiterating, I previously submitted a written statement on July 7th about this. And from a statewide standpoint, just to kind of repeat some of the things, is I believe it's important for there to be financial stability and accountability, because this is an expensive in Denver. There needs to be a clear and detailed project plan, so we know exactly what services we're getting and when we're getting them. Also, qualified and experienced leadership in this type of in Denver is or organization. And I think something that's also very important is a clear justification for a new department. What services aren't being delivered and those types of things. I think there should be, if there is some issue, there should be some effort with the current service provider to resolve those issues. We also need to look, I believe, at the harm that could come to other agencies and organizations. An example would be in West Covina, we have multiple school districts that serve multiple cities. So anything that's health related, they'd have to deal with multiple health organizations, health departments in order to service their people. And also the continuity of services. What service do we get from who and when are we going to get those? And probably very important too is the sustainable funding. We all know about how difficult it is for the current health departments to be funded fully, and the services they continually have to cut back. So they should be able to show a plan of how they're going to do that. And also, I think in general, for a local organization to start wanting to have their own health department when they're serviced by one seems to be wasteful. If you look at when we've had health departments developed, Pasadena, Oakland, cities, I forget what the other ones are, but they were remote from the county seats that would offer those types of services and needed to develop those. Long Beach is the other one, that they were away from where the organizations were, and it would take time for people to get there to service them, so they needed to do it themselves. And they had a large enough population and people coming in and out that they needed to have something that they could control more so locally. That isn't the case now. I could understand if we were looking at something where in San Bernardino County, out by the border of Arizona, that there might be some justification. In this case, I don't think there is any justification for an additional health department. So I thank you for your time, sir.
Thank you for your comments. At this time, I believe we have been through the list of phone numbers. If you have not commented and wish to comment at this time, please come off mute. If you have already commented, please stay on mute. You can come off mute by hitting *6 if you have not yet commented.
Hello, are you able to hear me?
5248, have you commented?
No, I have not.
Go ahead, please. You have 3 minutes.
I just wanted to add my voice to the contingent that is strongly opposed to this for all the reasons mentioned. The fiscal condition of the city and the way that everything this council has touched, they have run into the ground. This is a bad idea. And as someone else pointed out, there unfortunately are not enough people in the city that are aware that this is still being considered and that needs to change. It should be put on the ballot. Thank you.
Thank you for your comment. And 2138, I see you're off mute. Have you commented?
Not initially. So, hello, this is Dion Jimenez with SEIU, California. We have a number of concerns with the proposed regulations, and we will be submitting a comment letter. However, we hope the department can address a question regarding the timing of this proposed regulation, especially given the interplay of recent federal actions to undermine public health funding, and whether this potential new regulation could actually further destabilize public health in California. So thank you.
Thank you for your comment. I do not see anyone else who is off mute. If you have not yet commented, please come off mute by hitting *6. I have been through the list of phone numbers that I can see in front of me. Hannah and Michael, do you feel comfortable with me going ahead with a conclusion?
Yeah, I think just give it maybe another minute in case someone's trying to come off mute.
Okay.
Maybe ask one more time, give them a minute, and then kind of proceed from there.
Very good. All right, you heard it from our expert team at CDPH. We'll give it another minute, or, oh, I see, is it, no? 7400, you're off mute. I think you spoke previously.
I've already commented, but I just wanted to point out, I've already commented, but I wanted to point out on your mute, for some of those having trouble, you may have to hit *6 a couple times, because the first time I did it, it said there was an error. So I just wanted to point that out to you if there's anyone having trouble.
Yeah, cool.
But I have already commented, and I appreciate your time.
Thank you for the input on *6. Yeah. Again, if you have not commented, please come off mute by pushing *6 on your phone. As the speaker just mentioned, you might need to try that a couple times. We've heard from a number of people. Appreciate the comments. I'm scanning my list of phone numbers to see if anyone else is coming off of mute. If you have already commented, please stay on mute. Okay, I will begin reading my hearing officer concluding remarks. One last scan of the list of phone numbers, make sure nobody's coming off. And Michael, I assume you will keep an eye on that.
Correct, yeah, I'm watching.
Thank you. Okay, these are my official hearing officer closing remarks. California, is there anyone else who wishes to speak? If you've not already commented, as I said, please come off mute with *6. The California Department of Public Health Office of Regulations will continue to receive written comments until 5 p.m. July 12th at 1415 L Street, Suite 500, Sacramento, California 95814. I'll repeat the address for written comments: 1415 L Street, Suite 500, 500, Sacramento, California 95814, or by fax to 916-636-6220. That's 916-636-6220. Or you may email your comments to regulations@cdph.ca.gov. This has all been previously posted. Hearing no additional requests to speak, I hereby close the hearing. Thank you all for your participation. a good day.